Are you currently pregnant with twins or multiples? It's usually a bit of a shock at first, but as you get used to the idea of more than one baby growing inside your belly, you may start to have some questions about the changes that are going to be happening in your body. One of the most frequently asked questions is, what is the appropriate weight gain for multiple pregnancies? Hi there, a really big warm welcome from me, Melanie McGrice. I'm a specialist fertility and prenatal dietitian, and one of my favourite things to do is to help parents-to-be navigate nutritional guidelines to give their baby, or in your case, babies, the best start. In addition to this video and a whole bunch of other information-filled videos on my channel, I have a host of helpful information on all of my social media accounts, so feel free to connect with me there as well. You'll find all of the details in the description box below this video. Now in this session, I'm going to discuss weight gain for multiple pregnancies. We've all heard the adage, eating for two, or in your case, it might be more like eating for 3, 4, or even 5. This saying has been debunked a number of times, and dietitians worldwide now accept and promote that a pregnant woman should be adapting their energy intake according to their weight gain. It may feel a little scary to think that you're going to be gaining weight, but it's incredibly important to remind yourself that appropriate weight gain during your pregnancy is not the same as gaining weight from eating too much. When you gain weight during your pregnancy, there are two main components contributing to this weight. The first component includes your bubbas and their amniotic fluid and placenta, or placentas. The second component is the adaptations to your body needed to support your pregnancy, including the expansion of your blood volume, enlarged breast tissue and uterus, as well as a few kilograms of fat, which are there to give you energy for breastfeeding once your bubbas are born. So, when I explain how much weight you're likely to gain in a few moments, please keep all of these components in mind. Most of the research done in multiple pregnancies has been done in twins, mostly because having twins is much more common than higher order multiples. However, even though there's limited information, we do still have some guidelines for what constitutes appropriate weight gain for these groups. Let's explore each one in a little more detail. As with a singleton pregnancy, gaining weight is usually linked to the mother's pre-pregnancy BMI, or body mass index. Just a quick recap. BMI is your weight divided by your height squared. So if your pre-pregnancy BMI was less than 18.5, that's considered to be underweight. Between 18.5 and 25 is normal, 25 to 30 is overweight, and anything over 30 is considered to be obese. Now, it's also important to remember that these classifications are not meant to make you feel bad about your weight. Rather, we use them to help determine what kind of weight gain is best for an optimal outcome. A healthy mum and healthy babies. Too little as well as too much can be dangerous for all of you. So, let's start with twins. Your total weight gain by the end of your twin pregnancy should be around 17 to 25 kilograms for those of you with a normal BMI, 14 to 23 kilograms for those of you who are considered overweight, and 11 to 19 kilograms for those who are in the obese category. At present, there's not enough evidence to give recommendations for weight gain in mamas who are pregnant with multiples who are either underweight or who have a BMI greater than 35. So if you fall into either of these categories, it's best to get personalised support. If you'd like, you can book a nutrition assessment with one of our highly skilled dietitians at melaniemcgrice.com/booknow. Interestingly, when you gain weight throughout your pregnancy can also have an effect on your bubba's growth as well as how long you carry them. Remembering that term for twins is considered to be anything after 37 weeks. And you want to try to get as close to that as possible. A good rule of thumb for twins mums-to-be is to gain at least 10 kilograms in the first half of your pregnancy and then to gain the remaining weight in your second half. What about triplets or more? Well, for triplets or higher order multiples, the research is limited, but in general, best practice advice suggests that mums of triplets aim to gain 20 to 23 kilograms by 32 to 34 weeks, of which 16 kilograms is gained by 24 weeks, and mums of quadruplets to gain 21 to 31 kilograms by 32 weeks of pregnancy. So there you have it, the current consensus of how much weight you should gain when you're pregnant with multiples. Now I know it's a lot and it can be challenging to eat enough calories to gain adequate weight. Remember that weight gain is not the only factor that affects your health and the health of your babies. What you eat is also really important. So we have put together an amazing multiples nutrition toolkit for mamas just like you. To grab one, head over to melaniemcgrice.com/shop to get access to this valuable information today. Thanks so much for joining me, and I look forward to seeing you in my next video. There are two main components, right? Interestingly, when you gain weight,